Good evening. My name is Tiffany Anderson. The disease that I'm going to cover with you today is called Lyme disease. Lyme disease is a disease that is a vector-borne illness. Vector-borne means that the bacteria lives in mosquitoes, ticks, fleas, and things of that nature. Lyme disease, on the other hand, is particularly spread by the bite of an infected tick. Now, in the case study, we have a 26-year-old male who presented to his primary care physician with a rash. Now, this rash he notified the physician that the rash was the result of a tick he had. I want to say flea so bad, I don't know why, but the rash was the result of a tick. Now, he had taken this tick off 2 weeks prior. This tick he had gotten from a fishing trip with his friends. So he came to his physician because he had this rash, took the tick off. The physician checked him, looked at the rash, did an IgM test on him, which is basically immunoglobulin M, which tests for the antibodies of Lyme disease. The test came back negative. He sent him home. Now, this guy comes back about 14 days later. He has and he's worse. His symptoms are worse. He's extreme malaise. He's anorexic. He's been having some issues with his mentation. He also has some some swelling in the knees and joint pain. Now, these are hallmark symptoms of Lyme disease. Now, Lyme disease has 2 stages. It has the acute or early stages, and it has the later stages. It is easiest to treat when it's in its acute stages. Acute stages meaning they've only had it less than 2 weeks or so. It is still in the skin, which is why it causes the bullseye rash. Now, in the acute stages, that is the best time to treat it. And it can be treated with oral antibiotics very quickly. So identifying and treating Lyme disease is most important because the sooner the better. Outcomes are better for patients when they are diagnosed and treated immediately. Once the later stages of Lyme disease are when it moves past the skin. It's no longer subcutaneous. It moves past the skin and it's systemic. And this is when it causes the joint pain, mostly in the knees or hips. It's found the most in the knees. It causes the malaise. It can cause heart problems. It can cause mental issues. So this is a disease that can get really serious really quickly. So in the case of this gentleman, when he comes back, he is worse off, and the physician just doesn't believe. He's like, I already did the test. The test was negative. You do not have Lyme disease. So this gentleman sought treatment at another facility. Now, once he went to this other facility, it was a Lyme disease specialist in which he saw. I should note that it was a Lyme disease specialist. He went and saw them because he brought it up to his previous physician, like, maybe I have Lyme disease, and the physician just didn't feel that was the case because he had tested him. But he went to another physician, which was a Lyme disease specialist. The specialist noted that, the specialist, obviously, this is what he specializes in, so he ran the proper test on him. He did have Lyme disease. Now, weeks have gone by at this point, and he's definitely in the later stages. So he gave him the oral antibiotics. These did not work. They did improve his symptoms, but they didn't work. So then this gentleman did end up having to go on the IV antibiotics, and he was treated. It doesn't say if it was completely resolved, but it did help his symptoms, and it was resolved in a way that is satisfactory, obviously. But I don't know if he completely, if that was all he needed. That's as far as it went. So let's get into it. The thing about Lyme disease is best treated in its early stages. In its early stages, it causes the bullseye rash because in whatever area that the infection started, because it is in the skin. It is in the acute stage. It's easier to treat. It is not in your body's full system. Now, this is the time when they would treat you with the oral antibiotics like the doxycycline, amoxicillin, and cefuroxime oxidol. Excuse me, I'm sure I just butchered those names. You know them when you see them. During this time, this is the best time to treat. It's better to treat them early. In the later stages, you need IV antibiotics, and these include ceftriaxone, and penicillin. Early diagnosis and treatment is the best way. People can suffer from Lyme disease illnesses or illnesses related to Lyme disease even after treatment, and that's why it's better to treat them early. So in this man's case, he was seen early but wasn't necessarily treated because the test indicated that he did not have Lyme disease. The tricky thing about Lyme disease, though, is that in the early stages, people do not, when you use the IgM disease or the I'm sorry, I cannot remember this name to save my life, or the enzyme immunoassay in the early, the IgM or IgG in the early stages, they will always come back negative because your body has not produced enough antibodies against them in the early stages. So the CDC actually recommends that the best practice for treating Lyme disease is to test with the enzyme immunoassay first, and then you could and after that comes back positive, you can either use the IgM or the Western blot or IgG test. Now, in this case, the physician did not use the EIA first because this is the earliest detection of it. It is important that you use the EIA first or enzyme immunoassay because this will tell you if any further testing needed and is a more sensitive test. So that was the situation with our case study. Now, there is some controversy with Lyme disease. People think there are some bodies that think Lyme disease, treating them within 14 days with oral antibiotics and then IV antibiotics is the go-to treatment. That is the only treatment right now. But then there's other bodies who feel like people should be on long-term treatment with antibiotics. So that is a big controversy with it because although people still suffer from symptoms of Lyme disease for years sometimes, and some bodies feel that people should be on IV antibiotics for years. But testing and evidence-based practice, best practice does not say, cannot prove that is effective because they're not testing positive for B. burgdorferi or the bacteria that causes the symptoms of the bacteria that is the infection of Lyme disease. There's no vaccination for Lyme disease, and the best protection for Lyme disease is to wear protective clothing, wear tick and bug repellent, and obviously try to keep those areas clear, areas like picnic areas or places clear of leaves and everything that may house ticks. But that is all for our case study with Lyme disease. Thank you.